You are working your way towards the end of the ICD-9 codebook. This section will focus on injury coding using ICD-9 codes. There are major differences in coding ICD-10, injuries, poisonings, and adverse effects, and they will be presented in a separate lecture and corresponding exercises. The next two slides show the type of injury classifications found in our ICD-9 codebook under Chapter 17. Although there are many types of injuries, we are going to focus on how to code fractures and just a brief overview of burns in this presentation. You will have the opportunity to practice coding other types of injuries in the exercises provided. Learning the different classifications of injuries will help the coder know which key term to look up and how to assign the appropriate code for the injuries that are documented. So coding fractures, there's a couple key guidelines when we code fractures. So the first is, what type of fracture? Is it opened, closed, or pathological? There are examples of closed fractures that are provided on this slide and also in your code book. So when the doctor uses the term simple or impacted, we know that that's a closed fracture. If the term compound fracture is used, then we would know that that's an open fracture. Also, if you have a fracture with a foreign body, then that's also considered an open fracture. Remember, an open fracture actually protrudes through the skin. That can be kind of a gruesome visual image, can't it? So the important note for coders is that the fracture is always considered closed unless we have additional documentation provided by our physician. A pathological fracture is caused by a disease rather than trauma. For instance, someone with osteoporosis may experience a vertebral fracture that has nothing to do with an injury. When that happens, we're going to look under the term fracture, subterm pathological. This will direct you to a different chapter, and that's just correct. Back to the specificity of our fracture codes, the fourth digit will indicate whether it's a closed or open fracture, and the fifth digit indicates the specific bone that is broken. So let's practice. What's the code for a fracture of the clavicle? You may pause this recording and search for the code yourself. So when we look in the alpha index under the main term fracture, subterm clavicle, we see this information as you see on the left-hand side. We note that the closed is included in the parentheses, so that's the non-essential modifier. And so our code we're going to look in the tabular listing is 810.00. Don't be fooled, even though you have 5 characters. Remember, we don't ever code from the alpha index, and we need to go to the tabular listing. So now we go to the back of our code books and look up the tabular listing for 810.0. We see we are under category 810, which is fracture of the clavicle. Our fourth digit is 0 for closed, and we need a fifth digit. So we look at our information box that's provided, and we have some options of the fifth digit based on the actual site or specificity of the bone. In our example, we just have clavicle without further specification, so we are going to choose the fifth digit of 0. Clavicle NOS or not otherwise specified. So the correct code is 810.00. Note, if we had an open fracture, the code would vary in the fourth digit of a 1. So our fracture coding guidelines, there are many of these that we need to make sure that you read before you code. The multiple fracture codes state that if we have multiple fractures, that the specific code should be provided per each category. For instance, if I have a fracture of the clavicle and a fracture of the leg, I code both. There are combination codes provided when you don't have enough documentation in your record, like multiple trauma and you're transferring the patient, or when you have a limit on the number of codes reported. Also, the most severe injury per site is coded. For instance, if you have a dislocation at the same site of the fracture, you only code the fracture code. Acute care versus aftercare is a very important concept. So if the patient is not being treated acutely, like in the ER, and they're having or after surgery, you're going to use the appropriate V codes, which you'll learn about later on. So our brief overview of burns includes: burns are coded to the site and depth of the burn. You only code the highest degree of burn per site. So our degrees are first, second, and third, as most of us are pretty familiar with this. However, when coding third-degree burns, there is the percent of burned area that should be reported using the rule of 9s. You will find this included in your ICD-9 codebook.